Brilliance Audio presents Dissolving Pain, Simple Brain Training Exercises for Overcoming Chronic Pain by Fehmi and Jim Robbins. Performed by Graham Rowett. Renee is a lawyer who had her right knee joint replaced with an artificial one. In her hospital room the first night after surgery, her knee throbbed painfully to the point that she could no longer bear it. The doctor had prescribed OxyContin, a powerful opiate for pain relief, but after she took it, her knee still throbbed. Moreover, the medication nauseated her, and she couldn't sleep. Renee, however, was prepared. Years earlier, she had suffered from chronic lower back pain, and she had learned a powerful technique at our clinic for alleviating pain. I am a clinical psychologist and researcher, and for more than 40 years I've been teaching individuals how to improve their emotional and physical health using mental exercises in an approach I call open focus. These exercises involve nothing more than changing the way we deploy our attention. In the hospital that night, Renee took out a compact disc player and listened to an open focus exercise that guided her in dissolving her physical pain. A few minutes after she began the exercise, the pain in her throbbing knee started to subside. 20 minutes later, before the exercise was over, the pain was gone. She then used the exercise to help with the feelings of nausea. Within 15 minutes, her stomach settled, and she was able to sleep through the night. Renee's story may sound remarkable, and yet at our clinic we hear many such stories from our patients. This book presents the techniques that Renee and others have used to alleviate pain of all kinds. It also explores recent scientific research demonstrating that pain, whatever its causes, resides principally in the brain and can therefore be treated by working with the mind in specific ways. Martin's problem was different from Renee's. He suffered cluster headaches for years, and they greatly impacted the quality of his work in a demanding job as a stock trader in Manhattan. At first, he worked through his headaches, trying to ignore the pain or taking ibuprofen for relief. Cluster headaches, which can be so excruciatingly painful they are dubbed suicide headaches, are characterized by a sudden onset of sharp pain, usually on one side of the head, which lasts from 15 minutes to several hours. They come in groups over a week or two and then subside for a while. When Martin's headaches worsened, he started taking prescription medication so that he could keep working. Finally, even with medication, the pain became unbearable. He came to our clinic for help, and as he and I were talking, he said he could feel the faint beginnings of a headache, something sufferers call shadows. I took him into a treatment room where he listened to exercises similar to those Renee had used. Then and there, his shadow headache went away and did not develop into a full-blown cluster headache that day. Relief for both Martin and Renee came from following spoken-word exercises, such as the ones you will find in this book, which guided them to pay attention to their physical pain in ways they don't normally do, and allowed their bodies to quickly dissolve feelings of physical pain. The open focus approach to pain consists of powerful yet simple techniques that are effective with almost any kind of pain, physical or emotional, and virtually anyone can learn them and use them to improve the quality of their lives.